So, Melissa Bo Peep. Melissa Bo Peep is a 33-year-old female who had a sudden onset of dysphagia and unable to talk or follow commands. So she also couldn't move her right arm or her leg, and she had sudden onset of symptoms. So immediately you start thinking she has an ischemic stroke, left MCA, but she also can't move her leg either. So you're thinking ACA territory is involved also in this case, or maybe it's the internal capsule, who knows. So the first step is a head CT. Her head CT looks like this, all right? And I'm going to dim the lights for the rest of the lecture of these case studies so you guys can see these. So you look at the picture now, you can see the lesion, okay? So that's another thing too. Make sure that you have a nice, that's not bright light, because otherwise you won't see the CT scan as well. But you can see here, if you go to the good side, because we know everything's happening over here, the left, but you can see the boomerang there, see the little peanut there, your hot dog bun's kind of skinny there, it's weird, but then your piece of pie is there. But you go over here, it goes dark, light, and it stays dark. Everybody see the wedge there? Okay, so you have a left-sided lesion, but it looks more MCA than ACA here, obviously. So we can do a lot of things with this lady. We can do TPA, penumbra, solitaire, a lot of things here, a lot of options. And remember, when you give TPA, 0.9 milligrams per kilogram, 10% over a minute, the remaining 9% over an hour, checking vital signs and neuro checks accordingly. And this is what it looks like the next day. So it got worse. However, it doesn't really explain her leg weakness, because if you look at it, her ACA territory is beautiful. Her MCA territory over here is pretty ratty, and we opened up some of the MCA territory, but notice how it doesn't look like this. So we preserved some of the proximal portion of it, but we lost some of the distal portion of it, okay? So we started on aspirin on day 2, heparin sub-Q day 2 as well. Compression devices controlled her blood sugar and fever. She had a large MCA territory infarct. She went to rehab, and she had some permanent disabilities.